Welcome back to another explainer. I am so thrilled to guide you through today's topic because honestly, it's something absolutely every single one of us is going to face at some point. Today, we're demystifying the incredibly stressful, often confusing world of after-hours healthcare. By the time we wrap this up, you're going to have a rock-solid, actionable game plan for exactly what to do when illness or injury strikes outside of standard business hours. So picture this. It's 7 p.m. on a Saturday. Your primary care doctor's office closed at 5 p.m. on Friday, and they are definitely not opening their doors again until Monday morning. We've all been there, right? That immediate wave of anxiety and panic that sets in. You need medical attention, but your standard 9 to 5 safety net is just completely gone. Okay, let's dive into this. These scenarios happen all the time. Your kid suddenly spikes a 103-degree fever. Or, maybe you're making dinner and your partner slips in the kitchen, rolls an ankle, and suddenly can't put any weight on it. Your regular doctor is totally unavailable. So what's your next move? To figure that out, we've got a structured survival guide for today. The after-hours dilemma, your 4 care options, urgent care versus the ER, pediatric care after hours, and preparing for your visit. Let's get right to it.
Starting off with Section 1, the after-hours dilemma.
Because, as we know all too well, biology really doesn't care about business hours. The core issue here is this after-hours dilemma. It's that stressful gap in care, those super long evenings and weekends when you literally cannot wait until Monday morning. Knowing exactly where to go during this specific gap is the ultimate key to your healthcare strategy. If you make the wrong call here, you could be setting yourself up for hours in a waiting room, not to mention massively unnecessary medical bills. Which brings us to Section 2, your 4 care options. Now, what's really interesting about this is how distinctly these 4 options carve up the modern medical landscape. First, you have urgent care, which is perfectly positioned for non-emergencies and walk-in visits on evenings and weekends, though obviously it's not for life-threatening trauma. Then you have the ER. This is your 24/7 lifeline for absolute emergencies, but it comes with severe limitations for minor issues, mainly agonizingly long waits and sky-high costs. Next up is telehealth, a fantastic tool for a quick medication refill or, say, showing a doctor a simple rash over a video call. But notice the limitation here. No physical exams, no vitals, no labs, no x-rays. And finally, the nurse hotline, which is great for 24/7 advice when you're just totally on the fence about where to go. But remember, they can't provide actual treatment. So let's look a little closer at that first option, urgent care. These clinics are staffed by physicians, physician assistants, and nurse practitioners. They can handle the exact same routine conditions after hours that they treat during the day. We are talking fevers, ear infections, cuts that need stitches, and suspected fractures. And because many of these clinics have on-site lab testing and x-ray services, they are fully equipped to perform diagnostic work right there, even on a Saturday night. Moving right along to Section 3, urgent care versus the ER. $2,000. I really want that number to sink in for a second. According to the source data, $2,000 is the average cost of a trip to the emergency room. The financial stakes of making the wrong choice when you just have a minor injury, they're incredibly severe. When you put them side by side, the stark contrast is absolutely undeniable. On one side, urgent care typically costs between $150 and $300, with fast walk-in access for non-life-threatening needs. On the flip side, the emergency room costs well over $2,000. And here's the kicker. If you're there for a non-emergency, you will be triaged right to the bottom of the list. That means a 2 to 4 hour wait while actual life-threatening cases are rightfully prioritized. Choosing the ER for an ear infection is just a wildly expensive, time-consuming route. And this brilliantly illustrates your practical decision tree for making that choice in real time. Step 1. Is it life-threatening? We're talking chest pain, difficulty breathing, stroke signs, severe bleeding. If yes, go to the ER immediately. Do not pass go. Step 2. Do you need care today but you aren't in mortal danger? Things like fevers, minor injuries, or infections that have been getting worse over a few hours, that's urgent care. Step 3. Are you totally unsure? Call a nurse hotline or an urgent care clinic for some quick advice. And finally, Step 4. Are your symptoms mild or actually improving with over-the-counter meds? Just wait until morning and see your regular doc. All right, Section 4, pediatric care after hours. I want to slow down a bit here because we're shifting to something that induces a huge amount of anxiety for parents: sick kids. As any parent out there knows, children seem to get sick incredibly fast. And honestly, ear infections have a funny way of exclusively hitting on weekends, don't they? But the good news is, parents have fantastic after-hours options. Urgent care clinics that offer pediatric services can evaluate and treat kids for most common illnesses during those evenings and weekends. This means you don't automatically have to subject your child to a traumatic, chaotic late-night trip to the hospital just for strep throat. However, and this is absolutely crucial, we have to draw a clear line with these specific red flag warning signs. If you see any of these, an ER visit is absolutely non-negotiable for a child. If you have an infant under 3 months old with a fever above 104, if your child is having difficulty breathing, if there's severe dehydration, meaning no tears when they cry and no wet diapers for over 6 hours, or if they're experiencing a seizure or a suspected serious head injury. In these specific cases, do not hesitate. The emergency room is exactly where you need to be.
Okay, moving into our final course section, preparing for your visit.
Let's transition from making the right decision to taking organized action. Consider this your ultimate survival checklist. When you're rushing out the door at 8 p.m., having these items ready guarantees a smooth, fast visit. Grab your insurance card and photo ID. Bring a list of your current medications. If it's for your kid, grab their vaccination records. Be ready to provide relevant medical history, like allergies, and have a clear mental timeline of when the symptoms actually started. Oh, and if you tripped and fell at work, make sure you have your employer's workers' comp info. Being prepared is half the battle, guys. Now, let's bust a few lingering myths. A massive misconception out there is that visiting urgent care late at night somehow costs more than going during the day. Actually, scratch that. It doesn't. Most urgent care clinics charge the exact same rates regardless of when you visit. Your copay at 8 p.m. is the exact same as it is at 10 a.m. Also, you don't usually have to call ahead, though it's a great little hack to confirm wait times. And yes, these providers can electronically send prescriptions straight to a 24-hour pharmacy, meaning you can start treating the illness immediately. This quote from Mederi Urgent Care really hits the nail on the head. When illness or injury strikes outside of regular business hours, you have options beyond the emergency room. After-hours urgent care provides the same quality diagnosis and treatment at a fraction of the cost. That is an incredibly empowering realization. You are not trapped into choosing between suffering until Monday morning or footing a massive ER bill. Just to give you a concrete example from our source material of how accessible this care really is, look at Mederi Urgent Care in Los Angeles. They operate 4 different locations, and they're open from 9 a.m. to 9 p.m. 7 days a week, with one location even staying open until 10 p.m. This perfectly illustrates how the healthcare landscape has evolved to actually meet patients where they are, right on their schedules. So, I'm going to leave you with this final thought. The next time a fever suddenly spikes on a Saturday night, will you let the panic take over, or will you use the framework we've built today to take total control of the situation? You now have the knowledge to avoid unnecessary costs, skip the massive ER waiting lines, and get the exact right care for you and your family. Keep this decision tree in mind, stay prepared, and take control of your healthcare. Thanks for joining me on this explainer, and keep learning.